It has long been known that healthy employees translate into sustained productivity. However, are Malaysian employers investing enough in providing healthy workspaces for their employees? I talked to Dr Hazlee Abdul Hadi, an occupational health specialist at Prince Court Medical Centre, to get his latest insights. Hi Doctor, thank you so much for joining me in Talking Edge. Now Doctor, employers have long been encouraged to invest in employees' health. How willing are Malaysian companies to invest in their employees, especially in the healthcare of their employees?
It's getting better. Of course, if you're talking about multinational companies, they are more willing because it comes out from their company back home, really. And we see in terms of local, still a bit of resistance because of when you talk about wellness program, it involves some sort of investment, and extra money coming in. That's why for multinational companies, it has been practiced many years ago, and they have data, let's say, from 1995 to show that there's a good return. Some says rating says $1, you can get back about $6 in return. Of course, there's some they can measure when they implement the program, the wellness program. In short, multinational are more willing, and they've been doing it, but local company we beginning to start and having the wellness program.
Where do employers draw the line between investing in employee health care and as well as adapting or coping with the rising cost of living?
Very good question. Very simple. I think I like to go to basic. Preventive is better than cure.
Yes.
So if you do invest in health program, and we get majority of staff basically involved in the wellness program, at the end of the program, we want majority to become healthier. If they become healthier, then very likely, less likely for them to get sick. And if you get sick, then it won't be productive to the company. So I want the company to basically understand, if you do invest well in this program and you do well, there will be three outcomes. One is the cost, so lesser medical costs for you to pay for your staff, and then increased productivity. If less people getting sick, then you'll be more productive. And then number three will be morale. The high morale, they are healthy, they look well. So the three things basically is the outcome of a company investing in wellness or health program.
Now Doctor, interestingly you talk about return, and as with any investment, it must generate returns of investment. Now in the case of employees' health, right, what could the returns be for both the employer as well as the employee?
We have done one study here in Malaysia by oil and gas company here in Malaysia, just by giving flu vaccine to oil and gas company. So they put into two groups, one receiving it, the other one is not receiving it. The return is quite significant. So for per employee, when we talk about just labor costs, they get a return of about $50. $1 putting in, they get about 53 USD return. And when you talk about operating income as well, it comes to close about $900 return for every dollar they put in. Simply I put is, let's say you are hiring an engineer, for example, and he's earning maybe about 1,000 ringgit Malaysia a day. And if he's working, he can make, let's say, 10,000 a day. So by his not working, the company has to pay 1,000 and losing the 10,000 income. Just imagine. So basically in total you're losing about 11,000. So by reducing numbers of people getting sick, so we get both, basically productivity as well as operating income for the company.
Dr. Hazlee, as a doctor, what kind of occupational health diseases or injuries have you seen so far in your field of work that is common in Malaysia?
Okay, still the most common, if you look into statistics, will be musculoskeletal. It can be backache, can be pain over the injury over the arm, legs and whatnot due to slip and fall. That's still the commons. And the other one, if you look into statistics, is stress, mental stress. So those two I see quite a lot in terms of work injury or work illness. backache, musculoskeletal, as well as stress at work.
One of the DOSH 5-year master plan is to create a preventive culture, at least by 2020, which we know that prevention is better than cure.
Yeah.
But how are we in terms of reaching to that level? Have we been practicing preventive culture enough?
If you look at the statistic, Malaysia, we are number one to be overweight and obese in Southeast Asia.
That's scary.
That's very scary, yeah. We are, I think, a long way from to be preventive. But it's not all bad, really. By having all this session, we impart knowledge to the publics. We can do better by being a bit more aggressive. I think the channel of giving knowledge to people nowadays is no longer limited to newspaper and TV. I mean, a lot of youngsters now basically, refer to their smartphone, tablets, and we can basically use all this channel to give knowledge. And the good thing is that we can see change in people. For example, in Petron, the number is increasing just because we are using the message correctly, using the right channel. For example, last time people may be too busy working. So I have a nurse together with me in Petron. So what we do basically, we collect the data of people going for health screening, and we basically look when they are basically eligible for the health screening. So we will basically send individual email to them saying that, okay, it's already been 3 years since your last medical screening, you're now entitled for medical screening. And to our expectation, and by doing so a bit more what they call proactive in that way, we get a lot of people going for the health screening. So the program by DOSH, preventive better than cure, can happen. And it has been shown in that company, small company, Petron. We managed to get and encourage people to go for the health screening. And the number basically double or triple from the year previous, before we start this program. And so I still believe that we can do it.
Certainly, the benefits of investing in employees' health are obvious. Now, it's just a question of whether companies are going to be willing to pay.